Hi, I'm Dr. Mark Petropoli, otherwise known as Dr. P, founder and CEO of Victory in Motion, home of knee repair, not knee replacement. We're here today with Dr. Calabrese, who has rehabbed probably the most BEAR surgeries in the country, and Luciano Vigliotti here, one of our PTAs, one of our VFit specialists. And I'm going to kind of hand it over to Carl. We're going to be doing this 40 days of BEAR thing, which I've done for the last 2 years. And so we're going to be posting about 40 videos on BEAR. And this year I wanted to concentrate a little bit more on the rehab and the phases of rehab and the differences of the rehab from a BEAR and an ACL reconstruction. So I'm going to hand it over to Dr. Calabrese and to Lucci.
All right, so let's just pretend like we're at the 8 to 12 week mark. This is the exciting part for a lot of our patients. It's the part where the therapist really start to enjoy. You're getting them really off the table. You're starting to put their feet on the ground. You're starting to increase the compression load. You're starting to do some strength training stuff. It's important to remember what got you there though. So don't lose sight of the things that got you to the point where you're able to put the patient's foot on the ground and start to do squats, deadlifts, and those types of things. And as this is new, we also have to appreciate that the body has to adapt and change. So a well thought out gradual progression, a thought-wise progression, but also when they come in, re-examine the patient each time. If you do this perfectly, each phase they're not going to have those bouts of swelling, or they're not going to have that increased stiffness as a result of this if we're doing things properly. So it really does go back down to the basics, of just looking both sides. Do they maintain full knee extension here? All right. Oftentimes, right, we start putting our feet on the ground, we start doing squatting, all these things. If it's too much for the joint, it's going to get a bit angry. It only takes a small amount of loss of knee extension, as we know, to completely inhibit the quad strength, as well as a little bit of swelling to completely inhibit that quadricep from doing its job, which is our main mover. So at this point, sometimes patients go from walking and chewing gum, feeling pretty good, to now doing a little bit more strength training. We push too hard, they lose a little bit of the straightening, they get a little swelling in the joint, and all of a sudden they say, well, I'm having a hard time walking again. So it goes back, like I said, to the basics, really making sure they maintain full terminal knee extension. So hyperextension, not just extension. Also we're looking at their patellar mobility, making sure that they're not losing any patellar mobility, so there's not any compression on the backside of that knee. And in doing so, right, it's not uncommon if you do push too hard that you have to reestablish that terminal knee extension. That can be with some manual overpressure. And I'll show you a few ways that a patient can obviously do that themselves. And then once you reestablish that terminal knee extension, reestablishing that quadricep control. So I'm going to have Lucci sit on up. We're going to say that he's lost a little bit of knee extension. So anytime you lose a little bit of knee extension, it's important to realize what position our knee is most often throughout the day. We're often in a bent position. We're not often necessarily straight. So Lucci will swoosh forward towards the edge, get his leg out nice and straight. Put your hands just above your kneecap like you're going to give your knee CPR. And you're just going to push down, pressure on, pressure off. May get some stiffness, some soreness to start. Should decrease the more they do. If anything, they should feel like a strong stretch in the back of your knee. That's how you know that you're actually moving the joint and those tissues to their end available range, because you're stretching the backside of the knee. This is a good way of just reestablishing knee extension. Lucci can do this 4 or 5 times a day. Anytime he feels stiff, if he's sitting for a long period of time, just doing that alone should help actually loosen the knee up, and he should start to feel better walking, as well as getting up out of a chair if he sat for a long period of time. All right, so now we've worked on reestablishing the joint's range of motion, that full knee extension. Now we want to establish quad control. So simple things that Lucci can do. This is the forbidden long arc quad that often gets thought to be a terrible exercise for ACL patients. Only exercise you need to do to isolate the quadricep, fun fact. So all you're going to do, Luch, is you're just going to go all the way up. You're going to straighten that leg up, think further, 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 further. Straighten that knee, get that quad nice and tight there, pause, and then back down, and then back down nice and slow. Obviously, at this stage, if he's not having any increased pain, swelling, loss of motion, we can start to really load this up at this point. But really, we see that they lose that last little bit of extension, that quad control at end range. So reestablishing here, or reestablishing, I should say here, is super important. Really easy to do, very simple, right? They should be doing this already prior to this point. It's just making sure that they're maintaining that if they've overdone it. And then the other one I really enjoy for patients is, let's get you on your stomach. All you're going to do now is you're going to put your toe underneath you. Good. You're just going to push that knee up towards the ceiling for me. Squeeze that thigh straighter, 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 straighter. A good cue for our patients isn't not as hard as they can, but thinking about going further, further, further. I can take this to a progression to a plank, where you can do a little bit more of a hard plank. These are kind of lower level establishing, reestablishing that quad control at end range. And then obviously we'll show you some higher end stuff that you can do once you reestablish that quad control.